Welcome to Bold Moves Radio. The show is Prudent Woman with myself, Rhulani. You are welcome this evening. Those of you who are joining us on Facebook or YouTube, and those who are listening to us via Bold Moves Radio, you are welcome this evening. I would like to alert those who are who are watching us through Facebook. We are gradually migrating fully to YouTube. So you are encouraged to start watching us on YouTube, and please subscribe once you are there so that we can be able to see our channel growing. And we would like to appreciate you so much, all of you, our loyal listeners. We appreciate you. We do not take you for granted. And those of you who are listening to us for the first time in this show, Prudent Woman is a show that is geared towards empowering women and as well as the other gender to become ready for all seasons in life. We are a show that empowers people on different areas of life. You talk health, you talk finance, you talk professions, you talk beauty, all elements of life. That's what Prudent Woman is. And tonight, I'm not alone. I have with me Dr. Hlekani. Dr. Hlekani, she's a pediatrician, and would like to say thank you, Dr. Hlekani. We know the sacrifices that all medical practitioners take on a daily basis. We appreciate you so much. Today, I have Dr. Hlekani. We're going to be talking on a topic which is very close to her heart. I'm sure when you heard that she's a pediatrician, most of you already know we're talking about something that has got to do with our children. As we continue with the month of September, today we're closing, is the last Sunday of the month of September. We're closing the month of September, which has been geared towards awareness on issues of cancer. Tonight, we want to talk and bring awareness around childhood cancer. Even as we conclude our month, where as a nation we are celebrating our heritage. I'm sure today, those of you who are watching us on Facebook and on YouTube, who can see us, you can see today I look like Manana wa Mtsonga. Today, mina ngwa Patrick. You know, that's how we identify ourselves in my language, that is Shangan. And I am excited today to have Dr. Hlekani with us. She will be talking to us on a very, very important subject, that is childhood cancer. I'm saying very, very important because our children relies on us to give them care. They will never be able to fully describe what they feel, but it's upon us, those who are caregivers, to be able to observe them. And you can only observe and be able to take a decision when you are aware of something. That is why today's show is very important. And Dr. Hlekani is not only a pediatrician, she's a marathon runner. She runs quite a number of marathons, and she also runs Comrades Marathon. This is a lady who has ran the Comrades Marathon 5 times. And what is exciting this year, she was not only running for herself, but she was running for an organization that is doing some work around the very same topic we're talking about. They call the foundation CHOC, is Childhood Cancer Foundation of South Africa. Dr. Hlekani, thank you so much for joining us. And I trust that by the end of today, we will never be the same. As for me, I did not know before we started talking that there is cancer that is for children. But, you know, I know our audience today will be empowered. I invite you, greet our audience, and as you greet them, I would like you to highlight to us, what is this CHOC Foundation?
Okay. Thank you, Sister Rhulani, and thank you so much for such a warm welcome. Yes, I am a marathon runner. I'm very proud to have run my 5th comrade. I ran for CHOC, Childhood Cancer Foundation of South Africa. We will speak a lot about this organization as we continue. Cancer, it is one of the diseases which is happening everywhere and all around. And it is very important for us to talk about this awareness today and to alert you that there are organizations which are helping with the awareness of these diseases everywhere, and especially for South Africa. Here in Limpopo, we also have problems about our children with cancer. They are very poor. They have a problem of malnutrition, of which it helps a lot with these organizations. They give food parcels. And also, if ever there's a shortage socially, they also come in and help a lot. And I am very proud. I ran for CHOC this year. I believe I ran for a good cause. I believe I have helped a lot. I raised funds. I raised almost 6,000 rands, which was also donated to CHOC to help, to support, to make awareness so that cancer can be detected early in children. Thank you, Sis Rhulani.
Thank you, Dr. Hlekani. And we appreciate it because you are not only saying you are a professional, you are a pediatrician and it ends there, but you take it further. That shows the heart that you have for children. But for the benefit of everyone, and even myself, I want to fully understand it. We have spoken about cancer, but I want to understand when we say cancer within the children, what age are we talking about and what is it that we are saying a child has got cancer? What will it be?
Okay, I will start by explaining what cancer is. Cancer, it's abnormal cells which grow abnormally and they are very uncontrollable in a human body. We know that cells, they grow and also they multiply in a body by the process which is called, I believe we learned this thing in primary biology, mitotic division. And when they are old and also when they are damaged, normally these cells, they are able to be repaired, or new cells, they are able to be made according to the demand of the body. But when you've got cancer, then the cells, they grow and they form a tumor. And this tumor, we can say it can be malignant. Malignant, we say when it is cancerous. Or it can be benign. Benign, it's not cancerous. The cancerous one, they spread to the body and they are very harmful. Meanwhile, the benign ones, those, you see the masses, the tumor, they grow with which you can see. And then those ones, they can be big or small, but they are not dangerous. They can be removed and they don't recur. So this is the difference between these two things. But on the other hand, there are forms of cancers like leukemias and lymphomas. Those cancers, you don't see any growth. And in children, yes, cancer happens. And it happens mostly, we can say children, when we say children, according to WHO, it is from, we can say from birth, because they are rare, I'm saying rare cancers, which can happen from birth congenitally. And then up until 19 years old. But then we take new patients from children who are from birth up until 15 years old. Once you are 15 years old, if it's a newly diagnosis, then we treat you as an adult.
Okay, so it depends when is it that this cancer was detected?
Yes, yes.
When, maybe, you know, with health terms,
Yeah.
when you say congenitally, it's before birth.
Okay, I'm sorry about that. Congenitally, it means it's acquired. You get the thing inside when mommy is pregnant, inside the tummy. Yes.
Okay, so Dr. Hlekani, with cancer for the children. So it's something that they inherit, or it's also something that they can get even when they're outside, but just because they're still young?
In children cancer, it can happen anytime. You can inherit it. You can get it even when you are old. You are 5 years, you are 2 years, 1 year, any time during your development.
Okay. Thank you so much. Do not forget that you are listening to Prudent Woman with myself, Rhulani Baloi. Tonight, we are talking about childhood cancer. And the radio is Bold Moves Radio. All of you who are watching us via Facebook would like to remind you that we are gradually migrating to YouTube. We will encourage you to go and watch us through YouTube and subscribe once you are there so that we can see the growth of our channel. And we'd like to appreciate you so much for continuously being with us every Sunday, 6 o'clock until 7 o'clock. Our guest tonight is Dr. Hlekani. She's a pediatrician and she's also a marathon runner. I will say this because she is running for charity for the benefit of the very same topic that we're talking about tonight. Dr. Hlekani, you were telling us about the age that you classify to say is childhood cancer. You say it's from birth up until the age of 19 years. Yes. We have been talking throughout the month of September on different types of cancers. I would like you tonight, Dr. Hlekani, to highlight to us what type of cancers are children prone to getting. You know, we have spoken about cervix cancer, Yeah. So if you can take us through the different types of cancers that our children can have.
Okay. With children, most of the cancers which they have, they are also different from the adults. We had, Rhulani spoke about cervical cancer. Children can't have cervical cancer. Children don't have breast cancer. They don't have esophageal cancer. So with children, there are so many the cancers. But I'll speak of mostly the common ones which we see, and I'll talk about them according to the prevalence of them.
Okay.
Yes. The most common one we see, it's leukemia. Leukemia, yes, it does happen in adults. It also happens in children. It is, when we say leukemia, I'll say a layman's language, yes, we mostly say cancer of the blood.
Okay.
Yes, this happens from any age of a child. But most of our cancers in children, they happen between 1 year and 5 years old, most of them. Then the second one, it's lymphoma. Lymphoma, it's a cancer of the lymphatic system. You see the small things which happen sometimes when we've got infections and the lymph nodes, those gungas, a bit of nyenyas. In my language, you call it nyenyas. Yes, but the circulation there, the lymphatic system, that is the second one, which we call it lymphoma. Lymphoma also has got different types. But then lymphoma, when it is common mostly in boys. Commonly in boys. It does happen in girls, but it's common in boys. And this is the glands. Those glands, they are the glands which help with infections, to fight infections of any person. And then the third one, we can go to brain tumors. It is also common, the brain tumors. And then the third one, I believe, brain tumors, we all understand brain, it is. And then from there, we can get the nephroblastomas. Nephroblastoma is common from the age of 1 to 5 years again. This is the cancer of the kidneys.
Okay.
Yes. And with this cancer, what happens, it is very easy. Most of the mothers, they are the ones who detect it by just when you are birthing your child, you just see a bit of a growth, which is even painless.
Mm.
And the prognosis is so good with this one, with the nephroblastoma.
Mm.
And then the other one.
When you say it's simpler for parents to pick it up, so you mean there's a need for a parent to check the child?
Yes, yes.
Mm.
There's a need, especially when you are birthing your child. That is the most important time for every parent, that you birth your child by yourself sometimes. Get some time and birth your child so that you know what's happening to your children. Yes.
Okay.
And then the next one, it can be neuroblastomas. Neuroblastomas, they happen anywhere in the body. That is, whatever you see, if you see a big thing, a mass in your body, which just comes out, then that is an alert of that there's something wrong with the child. And then from there, we can go to retinoblastomas. Retinoblastomas, it's the cancer of the eyes.
Okay.
So with them, we are still going to talk about the signs and symptoms of cancer. I believe that's where I can also talk about all these things. Then the next one, it can be the cancer, the osteosarcoma. Osteosarcoma, it happens mostly during teenagehood, a bit of oldish children, 8, 9, 10, 11, pre-adolescent, adolescent. And then it's the cancer of the bones.
Okay.
Yes. But the most important thing in all this, it's early detection. Therefore, awareness, we are going back to it. It's very important.
Yes, Dr. Hlekani, even with the other doctors, what we've been hearing is that with cancer, the most important thing is early detection.
Yes, yes.
You know, that brings me to a point to say, as a parent or as a caregiver, it's important for one to know these things. You know, as I said to you, I've got, you'll say a young adult.
Yeah.
But it's unfortunate that one did not even know that there are cancers for children. That's how much we do not know about these things. And I thank God for his grace for I've gotten here without knowing these things, you know. But it's important. The time has come for us to know about these things. And Dr. Hlekani, I would like to believe there are certain symptoms that a parent or a caregiver should be able to pick up with a child, because yes, children time and again they're sick, you know, you hear the child saying, yeah, I've got a little bit of pain. Yeah. Sometimes the children just says it, or we believe they say it without them being sick because they don't want to do homework or something. But what will be the symptoms that you think a caregiver should look out for that should bring an awareness to say, I need to investigate more. Maybe there is a cause for concern here.
Okay. Rhulani, when it comes to the alert signs, let's not put it into the caregivers and the parents only. Everyone, the community, because now everybody should be able to see these things and be a saint to the next person with compassion. Therefore, it could be a caregiver, it could be a healthcare worker, wherever. Even as healthcare workers, we still need awareness. It can, the community, it's very important. The whole community at large should be aware of the symptoms, the signs. Then we should be saints. We use a mnemonic called Saint Siluan. I said Siluan, S-I-L-U-A-N. Please, you will help me to remember this letters.
S-I-L-U-A-N.
Yes, thank you.
Okay.
Then the letter S, if anyone in the community will know this, I think our kids will be safe.
Mm.
The letter S, it stands for seek help. When we say seek help, we don't seek help from the aunt, from the spiritual healer, from any other person. Seek medical help early, immediately.
Okay.
Yes. Then we go to the next one, which is eye. Eye, our eyes. If you see a new white spot, some people, they do have white spots, which are old, it's fine. But if it happens new, then think of something else. It's better to go to be checked than to say this is nothing. Go and then it is nothing, then it is fine.
Okay.
So the white spot, and then blindness, new onset of blindness. You can't see anymore.
Okay.
A new thing.
And it happens immediately.
It can come not suddenly, it can come bit by bit, but blindness on its own. Some people, they've got squint.
Okay.
Squint in eye. It's normal. It's a thing. Yes. But if it just happens like that, then no, we must be worried. Now, we are talking about children. We are not talking about adults. Then we go to L. L, it's lumps. Lumps, it's growth. Growth, we say sometimes, nothing. Lumps, which happens next, and then you find it in the axilla. Sometimes you find it underneath the chin, and also sometimes in the inguinal areas, just between the thighs. Yes, if they are big and you don't have any other disease, we know that when you've got an infection, you cough, you've got tonsils, they become big. But if they are big and you don't have any other problems, and then they persist, they never resolve for more than 3 weeks,
okay,
then we should seek help. And any abnormal lumps which you can find in the, I already spoke about in the tummy, incidentally, you see a bulge in the stomach or somewhere, just a growth anywhere. Also, sometimes it happens in the scalp.
Okay.
Yes. Then you must seek help. Yeah. And I forgot to say something when it comes to the eyes. Sometimes the eyes just goes, they protrude.
They protrude, yeah.
Yes, it's also something which we have to note. So now we will go to the letter U. U, it stands for unexplained fever.
Okay.
When you've got fever, we are sick. We are not well most of the times. People who are not well, fever continue for maybe more than 2 weeks. You don't have any reason why you are having that fever. You lose weight. You have body aches. Actually, you are sick. And there's no other explanation that you are sick. Then you must seek help. You must make sure the child gets help.
Yes.
And then we go to the letter A. That is where aches, body pains, bone pains, and the like. It's more like when you are not feeling well, but you also have aches in the body. And then we go to N. N, it stands for neurological signs, something which comes from the brain. Then now I'm able to walk, but suddenly the walk, it's something else. I was able to talk nicely, but the next thing, then the speech, it's not coming out nicely. And then headache. Adults have headache, it's fine.
Yes.
We are talking about children. Headache, which is also maybe associated with vomiting or not vomiting. So with all these things, if the community at large can get these signs, our children will be safe and they will be detected early and get help very fast. And the outcome will be pashash.
Yes. And, you know, doctor, the sad thing is that with children, it's very difficult. All these things that you have mentioned, Silwen.
Yeah.
it's very difficult, but it takes a caregiver or a member of the community who cares to ask. What's important is for us to give time to our children, and something that, you know, today's life is just too hectic, but there is a need to do that.
Yes.
I always say, you know, it's not worth it for me to run and want to make all the money in the world and on the name that I'm working for my children when I'm not giving attention to them. That's how important it is. So those are the most important people for you to give attention to before you go out and say you're looking for money, because money will not mean anything if your children are not healthy. If you leave this thing, you know, with a child, as you were saying, I asked myself, how do I get the child to be able to say, I've got aches? But as you think, they do, you know.
They do.
But they say it in their own language. You hear the child saying, it's painful everywhere. And then when you persist, because they think maybe you don't want them to say it, then they stop. No longer say it, you know. That's how much we need to give them attention. And those of you who have just joined us, the show is Prudent Woman, Bold Moves Radio. You are listening to myself, Rhulani Baloyi. I'm with my guest tonight, Dr. Hlekani. She's a pediatrician. We are talking on childhood cancer. We are bringing in awareness on cancers that children may have, and how can we make sure that we detect these cancers at an early age. At an early stage, because they say with cancer, the most important thing for recovery is the early detection. If you detect it in time, you are able to beat it using the medical science. Dr. Hlekani, you know, you talked about all these different cancers, and what I pick up, they are more similar to what we have as adults.
Yeah.
Not all of them, but some. And I asked myself, what will be the cause of cancer within children? You know, when a child is sick, most of the time, as families, and most especially in terms of us Africans, we attach everything to our culture and all this. We will find someone to blame. If I give birth to a child who already has got leukemia, you have done something wrong. There's something you have done, you know, as a parent, the child will not be like this. So I'd like you to just explain to us what will be the cause of these cancers. Is the cancer that children suffers from hereditary, or is it things that us as parents or caregivers will do to them when they are still young?
Oh, Rhulani, it's a difficult one when it gets to the cause of cancers in children, unlike in adults. It is multifactorial, but then the cause, mostly it is unknown.
Okay.
Yes, it can be genetic. In some children, they are born with like the genetics, the chromosomes, they've got new mutations.
Okay.
And of which now they are prone to having cancer. Yes. But then it is also environmental factors.
Okay.
Environmental factors, researchers has been going on. It is multifactorial, but the cause straight, it's unknown. There are risk factors like radiation. Okay. You see the x-rays, we go for x-rays now and then. I go to this doctor, I want an x-ray. I go to this one, I'm diagnosed with an x-ray. I don't want anything. I request it, I will pay for it. I get more x-rays, more CT scans, those things. They've got radiation. You are also prone to having cancer with radiation. But it doesn't mean that when you go for radiation today, now you will have cancer. No, people should not be scared to go for the x-rays. It's when you abuse those things. Yes, but MRI, it's always the best, but it's very expensive, and it's not something which we can use now and then. We have to start there. The challenge is those people who goes to this one. I go to this GP. Oh, I want an x-ray. Oh, I want an x-ray. Oh, you go to this GP, you do an x-ray, you feel like, no, that was not fine. You go to the next one, you are shopping around, they do an X-ray. Those are the kind of things which we must try to limit. So if you have done an X-ray once, have that X-ray. If it's within a short space of time,
use it again.
Use that X-ray again.
I didn't know about that.
Yes, radiation. Radiation is just like light, but for children, mostly it's that radiation of the X-rays and the CT scans. Then another thing, you see, in my language, in Shangaan, they say, awuteki makwawo. Yes, that thing of marrying a relative, consequence marriages, it's also a risk of having cancer, a child with cancer, because when it comes to the genes there, it's just something else.
Okay.
Yes, you find the genes are not made properly, then the cancerous cells will be able to develop easily. And then the other thing is, there are children who are born with some conditions, and these conditions, they are prone to having, because they've got genetic abnormalities, and they are not able to fight the cancer cells, therefore, to make proper cells. Therefore, they are also at risk. But it doesn't mean that when you have those conditions, you are going to have cancer, but there is a risk. Conditions like Down syndrome and also Fanconi anemia, yes, that is when you find that you are not able to, you are prone to having cancer, some type of cancers. Yes.
Okay. So, Doctor, what I came across when I was trying to prepare for this show, if you're saying it's also hereditary, I asked myself, are the siblings at risk? Let's say I have 4 children. Should I be worried when we have detected this one has been diagnosed with cancer? Should I keep a very close eye to the other children in the house, or is not related at all?
You don't have to be that worried, because not all cancers are genetic.
Okay.
But this one I'm thinking of now, bilateral retinoblastoma, when it is bilateral, some are genetic.
Okay.
So therefore, with those ones, then you should keep an eye on the siblings. Yes, but not all the cancers. As I said, that it's most of them, it's just environmental factors. Yes.
So when we talk environmental factors, can we also include issues of malnutrition or availability of correct nutrients to feed a child when they're still young? Is it related?
No, unfortunately, when it comes to diet, unlike in adults, when it comes to diet, with children, it's not a risk for having cancer. The diet, it's only a risk in children who already have cancer, for them not to heal well. They will have poor outcome, because remember, cancer it takes the immune system down. Yes. Malnutrition takes the immune system down. And then on top of that, the chemotherapy is going to take the immune system down. So we are fighting 3 battles at once. Okay. Yes. So, but it's important they should be well nourished.
Oh, yeah, today we are learning something new. You see how different it is from the adult cancer. Yes. So you cannot say, I now know about adults, and then there's no need for me to understand about children, because they are at different levels. That's what I'm picking up. Doctor, you spoke about the risks associated with us getting married, sisters or brother and sister getting married, closely related partners getting married as a risk, one of the risks. And I'm asking myself, is there anything beyond that that parents can do, biological parents to say, can do to reduce the chances of a child being born with cancer or developing cancer within the childhood phase?
Yes, Rhulani, that's another question which is more different from adults. As a parent, when you can't do anything, it's beyond your control. Except for these ones which I have already mentioned, the environmental ones, radiations, and also consequent marriages. But otherwise, there's nothing we can do to prevent it as parents. The only thing is to do what? Early diagnosis, awareness. We must know the signs early and detect it early, but you can't prevent it.
Yeah, I think you are bringing in an awareness to most parents. I know this is a challenge to most parents. When a child is not well, a parent tends to blame themselves. You feel like, maybe I should have done this. Some people will tell you, when you were expecting, you should have not done this, you should have done this. And at times, those are the things that weakens one. Instead of being strong to stand and fight this thing that you are fighting with your child, as you blame yourself, you also, make yourself to be weakened, and you're not able to be there for the child. And at times, that's what leads us not to be able to detect diseases earlier. Because at this time, the child is telling me, I have these symptoms and I'm trying to fight my blame, so your attention is divided. And thank you for bringing in that awareness, because as a parent, there's nothing that one can do. But the most important thing is for you to give your child attention. I love what you said, Doctor, to say, as you bath the child. That's very important, and something that most of us tend to neglect. I'm saying this, ladies, say, I know the prudent women are not doing that, leaving it to our helpers. And I'm not saying our helpers are not doing their job, but they do it. But I think it's much more better if you, as a parent, as well, a biological parent, takes time and do it at times for yourself. You cannot finish the whole week without checking on your child, I always find it to be awkward. Even if you're tired, try to make sure that you give that time. Once a day or once in 2 days, at least you have an opportunity to assess your child. Doctor, we're talking about children from birth until 19 years. I will understand from 12, 13, at least they understand. But I'm just thinking, with my 6-year-old, you say you have to go for treatment. And thinking of the treatments that are being given to adults, I'm already scared. And asking myself, what type of treatment do you give to these children at this stage?
Rhulani, the treatment they get, it depends. Number one, it depends on what kind of cancer is it. If it is a malignant one, then they have to go through chemotherapy. And you know what? It's us parents, adults who have problems. Kids are amazing.
Is it?
They are amazing. They understand this and they accept earlier than parents. It's so easy to treat them because even when they are going through chemotherapy, they are getting chemotherapy. Chemotherapy, it's a medicine which helps to fight cancer cells. And when you are taking chemotherapy, you are receiving it. Just like you said that it is horrible in adults. Yeah, you get scared because you have seen adults. Yes, kids, yes, they will have some symptoms. But even when they are in that situation, they still have that love. They are so affectionate. Children are children. Huh? They accept it and they will still be playing. So unlike adults, they tolerate it so well. And somehow now I'm starting to feel that maybe the symptoms are not as bad as in adults because of the way they are. Yes. And we are also there. as medical doctors, they get love. We are so sympathetic with them. And whatever happens to them, if they are vomiting, we give medication. If there's this, we make sure that the symptoms are not severe. Yes, but they are beautiful, beautiful kids in that circumstance. And you will enjoy being around them. Yes, it can happen that one, its miracles are able today, but tomorrow he or she will wake up and then life goes on, and they accept. They will even want to come to the hospital so fast to get their treatment. Unlike adults, it's only you, the mother, who will say no.
And you know, with adults, I know, and I have loved ones who passed on just because they could not bear the thought of going for chemotherapy. That's why I was hoping that there is something else that you do for the children. And it's amazing to be told that children go for it. And I think this is an encouragement to all of us to say it means it's not bad chemotherapy, it's the mind. Ne? It's how we will have projected it, how we will have thought about it to say it's bad. So because a child cannot think to that level, cannot process the information to where as an adult I process, they receive it as it comes. That's what I would like to believe maybe the reason.
I don't know. I will only say children are just amazing.
They are amazing. And they have faith. They have faith. You know, with children, they have faith. With us, the faith is limited. That comes your own wisdom. We now detach from the wisdom that we are given. And I see, Doctor, before we continue, I see Sesnom Samaluleke asking us that are there allergies that can be associated with cancer, or that can lead to cancer?
For children, no allergies are associated with cancer, and no allergies can lead to cancer. But any person can be allergic to any medication. So maybe allergic to some treatment, but risk of getting cancer because you have allergy, no.
Okay. And I see someone is confirming that pediatricians indeed they are nice. She's actually implying that the reason the children go for chemotherapy willingly and joyfully is because pediatricians are nicer than other doctors. And she says she was so sad when at some point the pediatrician told her, you can no longer consult with me, you are an adult.
Yes, they cry, they cry.
So that because doctors, you know, they tell it as it is, but pediatricians are always nice. And thank you so much, Dr. Hlekani, because we understand it's because of your sacrifice. Without your sacrifice as doctors, we will not have this. Our children are able to stand this pain, able to have faith that they shall receive their healing because of your sacrifice. I would like to remind our viewers, those who have just joined us, the show is Prudent Woman with myself, Rhulani Baloyi. I'm your host. I have with me tonight Dr. Hlekani. She's a pediatrician. We are talking on childhood cancer, bringing in awareness around issues of childhood cancer. And Bold Moves Radio is gradually migrating fully to YouTube. In the next few weeks, we shall no longer be airing on Facebook. So we encourage all of you, please subscribe to our channel on YouTube. The channel is still Bold Moves Radio. Please go in and subscribe. We'd like to thank you even for continuously watching us. It's exciting to have you through and through. Dr. Hlekani, I read they are saying childhood cancer and adult cancer, the chances of recovery, it's higher in childhood cancers. I guess it's credited to what you were saying about children being able to receive treatment. But again, statistics that shocked me was that in developed countries, the rate of recovery is about 80%. And in less developed countries, it's 50% and down. And in our country, it's 55%. And what will you attribute these differences in recovery rates depending on the level of a country in terms of their economy?
Okay, I'll speak mostly of Limpopo.
Mm.
Limpopo is a poor, what do we call it?
Province.
Province.
Mm.
Most of our children, malnutrition, I have spoken about it. And another thing, the knowledge. Lack of knowledge. That's why we are coming back to this month, awareness.
Yes.
And I believe people got it.
Mm.
And also they will continue spreading all these things. And then another thing, it's our belief system. Something will happen to a child, you will see, this is it. But then our belief system is we start by using traditional healers, which, okay, it's fine. For some, it might help, but in this situation, it doesn't help. And then they delay seeking help. And sometimes, because even if the parent can come to the hospital early, you find they came, they managed to be there, things were well, but then because you are not alone.
Yes.
Number one, you left a husband at home. The husband doesn't understand anything. The husband, you can't leave a 2-year-old child alone. Then the husband wants his wife at home again. Then you will force yourself to go to save your marriage. You will go back home. When you go back home, what happens to a child? You no longer come back for treatment. We've got a grandmother or an aunt who says, no, this needs Gogwan mang mang mang, grandmother mang 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 mang. They remove you again from the hospital. Or when you go home, you never come back. Or they take you, you come back, but now it's late. So those are the most challenges which we see around, of which still it goes back to awareness. And also we need mostly spiritual healers, because they go to spiritual healers and then they are told this and this and this. They don't come back to the hospital. They believe it is this and this. Meanwhile, also in the hospital again, we need to strengthen again the social workers, the occupational therapists, and also the psychologists to help these patients. Not the patients, we help the caregivers so they understand the situation. And it can't be the caregivers alone. The family, this mother needs support, and the father, they need support. So if there's no support, most of them, those who are not that strong, they end up defaulting, and then we will have challenges when it comes to the outcome.
So what you are basically saying is that the reason developed countries' recovery rate is high is because of early detection.
Yes.
And early detection, it's only based on awareness. And I would like to believe at this day and age where even us here in Africa, I would like to believe almost every community has got a smartphone. This should be the things of the past. We should start to use this information to empower ourselves. Gone are the days where one should stand there and say, I do not have the knowledge or information to be fighting something. So this is one of the things that we are doing tonight as Prudent Women, to say, let's bring in awareness. And the awareness must not work only for you, but it must work for the whole community. Dr. Hlekani, when she started, she was saying it's about the whole community, not only caregivers or parents. But Dr. Hlekani, you also told us that this year you were running at the Comrades Marathon for a foundation which you call CHOC. And I would like to believe this foundation is working towards bringing in awareness. Maybe if you can tell us a little bit about what this foundation does, so that some of us will be able to follow it and be able to see how we can also be partners with this foundation. How can we contribute towards this foundation, and also to learn or bring it to our own communities so that we can bring in the awareness?
Okay. The Childhood Cancer Foundation of South Africa, it is a foundation which is only attributed, they only concentrate on children, not adults. So they support all the hospitals which have cancer patients, which treat cancer patients. Remember, here in Limpopo, it's only one in Polokwane.
Yes.
Yes. But then the main office, it's in Johannesburg. Here, our office, it's very small. So that's why it's not really known in Limpopo. So what happens is, sometimes what we can do is just to go to their website and we donate any amount.
Okay.
Or we go to the offices. The office of CHOC here in Polokwane, it's in oncology, Peds Oncology Ward, here in Pietersburg Hospital. There's also a base social worker that also helps there. So she's the one who can help with CHOC. And this CHOC, what they do is they help with food parcels, like I spoke about malnutrition. Our children, when they go home with cancer, they get food parcels. If ever there are social issues, also they've got their own social workers. They've got their own psychologists, occupational therapists, which help. So it is a multidisciplinary organization. They are able to employ people and they pay them, and they are able to support the caregivers and also the children. There are also people who are able to donate money through like sports. You can be a member if you cycle, if you run, and also if you swim. Then you can be a member and you run for them while you are raising funds. The money, when you register and everything, and you are also able to, the money goes to the foundation, and they are able to help these kids. Sometimes you might find that there's an emergency, we need a parent immediately. That parent doesn't even have a cent. Money can come out, and then make sure that the parent arrives to the hospital very fast and do what is supposed to be done. So there are so many things which they are helping. Actually, it's for the well-being of cancer children. And when we talk about the well-being, we are including the family.
Okay.
Yes.
So, Dr. Hlekani, this foundation, if I have someone, a family that has got a child with cancer, are they able to approach them for assistance?
Yes, they can approach them, and then they can refer them to the appropriate facility.
Oh, okay.
Yes, yes.
Oh, so, you know, and when you're sitting and do not know all these things, we tend to feel like there's no support.
No, support is there, and it's a lot.
It's a lot of support. And from what you're saying, you know, an organization like that, I would like to believe they will also give you the assurance as a parent to understand exactly what you're going through. Because as you indicated, the most important thing in recovery with children is upon the parents, for them to understand what they are going through. And I see our sister Hlekani, she's saying, she appreciates this session so much because 10 years ago, she lost a nephew because they discovered the cancer when it was too late. And as well, when the child was going for chemotherapy, it was always too hard for them to bear. So you can also attest to what you are saying, to say it's mainly us, as the family, we need to understand and have that support for us to be able to assist the patient to beat this disease that they are facing. Oh, you have taught us a lot today, Dr. Hlekani. And those of you who joined us now, the show is Prudent Woman on Bold Moves Radio. We were talking about childhood cancer. You can go back and watch and be empowered to know how childhood cancer can be detected, how we can fight it, how we can make sure that our children, they get diagnosed at an early stage, because the recovery rate for children's cancer, it's very high, but it depends on early detection. Dr. Hlekani, I know you said at this point in time, you don't know in terms of children, what are the causes for these cancers, unlike in adults.
Yeah.
I just want to ask for those of our viewers who likes reading or checking through things, do you know of any research that is currently going on around the issues of childhood cancer that one can follow up, even as we continue, even though we'll still ask you to come back, with medical science, it keeps on changing because research keeps on bringing in new things. But do you know something currently that one can follow through to acquaint themselves with?
In South Africa, we have Cancer Foundation South Africa. This is the foundation which support all the researchers in South Africa who are doing researches about cancer. And most of the researchers, if somebody wants to know, is to go to their website.
Okay.
And still the research is being done, but the cause is still unknown. And most of the researchers they are also down outside. We know outside that those developed countries, that they are far ahead from us, but it is continuing even with us. And Cancer Foundation is on it. They always support any person who is doing the research. And also with CHOC, if somebody can go to CHOC, their website, you are also able to read a lot about all these kind of things. They put also some researches there.
And for our viewers who will want to, CHOC is CHOC, ne?
Yes,
Not CHOC, the one for writing on the board. CHOC, if you like to follow through. We will not thank you enough, Dr. Hlekani, and as well as your fellow colleagues. We appreciate so much the sacrifices that the healthcare workers are giving. And we know it's a sacrifice, it's a calling. I don't think I can do it. It's a calling. And we appreciate you, and we appreciate the knowledge that you gave us tonight. I would like to invite you as a pediatrician, anything that you want to tell us tonight around children, how to care for our children. I know you love the children, so I don't want you to leave without giving us something on caring for our children at this day and age.
It's a broad thing, but I think the best thing is to say that let's be there for our children from the beginning, and we make sure that they feel our presence. And that way we will be stimulating their development and they will grow well. And all the next thing I can say is together. When I say together, I mean the whole world. If we work together, we need each other to fight this battle. Then we will win. And there is hope. Thank you, Sister Rhulani.
Thank you so much. Time is no longer with us. If it was up to us, we'll continue this talk until, because you can never learn enough. We're talking about children, a group of people who at this point in time, they are not able to express themselves, but they also experience real issues in life, and they need you and I as their parents, as their caregivers, to look after them. And thank you so much for joining us. I trust that you have learned. Those of you who joined at the end, as I indicated, you can go back and catch up with us. And all of you on Facebook, we encourage you, please migrate to YouTube as we gradually migrate the Bold Moves page to YouTube fully. And when you are there, please subscribe to our channel. Thank you so much for joining us. We shall be with you again next week, same time, same place, 6 o'clock until 7 o'clock. And I will not want to leave without saying thank you to our father, Pastor Strike, the executive producer. The show will not be here without him. Thank you so much, Papa. May the Lord bless.